Good morning and welcome to the Haven Financial Group radio show. I'm Larry Colvig, founder and CEO of the Haven Financial Group. Feel free to give us a call, 612-504-8400, or always visit us online at havenfinancialgroup.com. Kim, great to be with you. It's Father's Day weekend, and so we're certainly greet all the fathers out there. But again, good to be with you. We got Glenn Ramey with us this week because we're going to talk about a lot of insurance topics. Really exciting stuff, but extremely important, right?
Yeah, absolutely. Well, happy Father's Day to you, sir. And Glenn, I don't think I've ever asked you. Should I be wishing you happy Father's Day as well?
Yeah, yes, indeed.
There we go.
8-year-old daughter who just finished second grade this year.
Well, congratulations to you. And I hope both of you have a wonderful weekend and enjoy it with your families. That's for sure.
Thank you.
Yeah, we're going to talk about insurance. I've learned a lot about insurance, Larry, since you and I have started to work together here to doing this show, because I think a lot of times people think about medical insurance and they think about life insurance, and they think of them as medical insurance is used for medical purposes and life insurance is used when you die, it insures your life. But that's not necessarily the case anymore. There's a lot of other means by which to use insurance. And in fact, the theme of our show today is how insurance and retirement really go together. And I think a lot of people may not think of them in that way. So I'm anxious to hear from both you and Glenn about this subject. We're going to begin with healthcare and long-term care insurance and retirement. Then we'll talk about how life insurance can support your retirement, understanding annuities for your retirement. And then finally, we'll wrap things up talking about some of the biggest mistakes that people make when it comes to insurance and their retirement. So let's get started, gentlemen. First by talking, I think, and Glenn, we have had the chance to talk to you about this so many times, and I don't think that we can talk about it enough. And that's this whole idea of health care and long-term insurance, because when you get to retirement, these are two expenses that are some of the greatest for those who are in retirement. So planning for this can't start early enough, it doesn't seem to me.
Yeah, absolutely. Right. As of 2024, they're expecting that a average 65-year-old entering retirement could be expecting $165,000 in healthcare cost, not counting long-term care cost. Yeah. These are our health insurance premiums, our out-of-pockets and copays and medication costs in retirement, not counting assisted living facilities, nursing homes, and home health care. Because again, as we've talked before, our health care doesn't give us benefits for those services. Those are something that we have to plan outside of our health insurance for.
Absolutely. Let's talk about Medicare and the fact that this is there's lots of the ABCs of Medicare, and there's a lot of confusion related to it. And if you are approaching 65, there are some dates you need to know. There's really a lot that you need to know.
Yeah. So one of the most important things to remember about Medicare is that for most of us, it begins when we turn 65, in the birth month that we turn 65. And there are some exceptions to that rule, collecting Social Security disability payments for 24 months. On the 25th month, you're automatically enrolled into Medicare. Or if you have diagnosis of certain healthcare conditions like kidney failure or ALS, you become eligible for Medicare prior to age 65. But most of it's going to be that 65th birth month and the 7-month enrollment period that revolves around that birth month, 3 months before it and 3 months after it, to get our Medicare in order without facing any penalties or being late for it in that regard. If we're collecting Social Security prior to 65, we get automatically enrolled. And sometimes we have to disenroll because we don't want it all at that moment. Other times, we're going to want to actively apply for those benefits because we're not collecting Social Security, or even delayed Medicare because we're under work insurance instead.
Mm-hmm. Absolutely. But really quickly, before we get too much further into this, we just want to remind everyone that we don't anticipate that at the end of this hour-long program, you're going to have all the answers when it comes to insurance. But what we do hope is that this answers a few of your questions, and you realize that maybe you need a partner when it comes to making decisions associated with insurance and retirement and all things retirement. And the folks here at Haven Financial Group are certainly there to partner with you. 612-504-8400 is their number. If we, strike a chord with you throughout the hour here and you have more questions, please be sure that you call that number and set up an appointment with the folks here at Haven Financial Group. It's 612-504-8400. So let's just, again, we can't get into this too terribly deep because we don't have enough time for it, truth be known. But let's talk a little bit about the ABC of Medicare and how this works, if we could.
Yeah. So let's start with Part A of Medicare. In the simplest terms, it's our inpatient benefits in Medicare. Hospitalization, hospice care, inpatient skilled nursing facility for rehab, and a limited home health care are all covered by Part A of Medicare. As long as we or our spouses have 10 years of work history, 40 quarters, we qualify for Part A at no cost. We prepaid for it with our taxes, right? Mm-hmm. Part B of Medicare is the outpatient benefits in the simplest term. Our doctor appointments, our testing, our day surgeries, but also includes durable medical equipment, injections and infusions done at a doctor's office, as well as ambulatory services are covered by Part B. And with that one, there's a premium. Today, $185 per month, although we can talk about some means testing on that. We'll save that for later. But right now, most individuals pay that $185 a month. Part C is a reference to a type of Medicare plan we do called a Medicare Advantage plan, otherwise referred to as Part C, that can include our A and B benefits as well as our D benefits, our prescription drug benefits under Medicare, either integrated into a Medicare Advantage plan or something purchased as a standalone benefit for those that do Medicare supplements or Medigap policies, which is, I'd say, not a letter to it, but another component of Medicare is the Medicare supplement or Medigap policy, where Part C, Medicare Advantage, we assign our Medicare over to an insurance company to manage on behalf of the government. People with Medicare supplement plans are using those original Medicare benefits along with the Medicare supplement plan to join in and cover those medical bills for us.
Okay, fantastic. This can get expensive.
I can, yeah. I mean, technically, Medicare plans can start usually as low as just your Part B premium. Mm-hmm. But I have clients, at least in Minnesota here, that easily can pay up to $500 a month for a package of Medicare benefits, right? Mm-hmm. And that a lot depends on what you're looking for out of your insurance, who you want in charge, how you want those benefits to work. Larry hears me all the time say there's two reasons I tell people they want to pursue other insurance above and beyond what the government provides us for healthcare. That's the limited nature of Part A's benefits, only covering 150 consecutive days in a hospital stay, us being responsible for the 151st day, God forbid we're there that long, which I know none of us want to do. And the fact that Part A and Part B of Medicare do not have out-of-pocket caps to them. So by themselves, there's no limit on our exposure to medical bills. So we introduce these advantage plans, these supplement plans to fix those problems with Medicare. And Larry hears me incentivize all the time, fine, the fact that with Medicare on the Advantage and supplement side, you really need to get educated on both options in Medicare and understand the rules of both and the pros and cons of both to make sure a decision about healthcare is yours and not someone else's, right? Because they're leaving out information that you might find important in that decision-making process.
And Larry, one of the things that's really interesting about this is that these vary from state to state. So it's important, if you are listening to us because in the summer months you live in Minnesota, but in the winter months you live in Florida and you actually call Florida your home, it may vary from what it would have been when you lived in Minnesota.
It does vary, which is another reason why you should have a good partner. And I can tell you that Glenn here has the knowledge on the ins and outs of the insurance side of the business, as well as Isabella at our office. Navigating healthcare can be very complicated. It can be overwhelming for many people. Where do you even start? We're just scratching the surface here on Medicare, long-term care, other insurance. So you got to understand what your choices are. And Glenn said it very eloquently, getting educated. You don't pay any more to have somebody do the work and educate you about Medicare and all the different options that are out there. So, I encourage folks, insurance is one of those things we don't want to talk about. If you need it, you wished you had it. If you're paying for it and you don't need it, then it was a waste of money. And some people would just rather skip it. So maybe not a good idea. Maybe it's a good idea to give us a call just to have a conversation. And that's really where it starts, getting the information so you can make an educated decision.
Absolutely. Let's give everybody that number again. It's 612-504-8400. That's how you reach out to the folks there at Haven Financial Group, 612-504-8400. You can also go to havenfinancialgroup.com. Glenn Ramey is our guest, and he's an insurance expert who works there with the team at Haven Financial Group. We want to get into long-term insurance, but I think what we'll do here, gentlemen, because I think it's so important, let's take a quick break. And then when we come back on the other side, let's talk more about long-term health insurance, or long-term care insurance, rather. And then we'll also talk a little bit about life insurance and how that can support your retirement. Again, that number, 612-504-8400. You're listening to the Haven Financial Group Radio Show.